Okay, so I think we will kick off then, because we are a little bit pushed for time. We're going to aim to talk for no more than half an hour and leave about 15 minutes for some questions at the end, because I think that's often the bit that people get most out of, to be honest. So welcome to this session on applying for an NIHR Doctoral Award. Specifically, we're aiming at our local authority colleagues for the purposes of this session. I'll start with a quick introduction to myself and my colleagues who are also online. So my name's Louise Hayes. I'm based up in Newcastle in the Specialist Centre for Public Health. Also online are Laura Tucker and Mark Wilberforce from the Specialist Centre for Social Care. And joining us, I'm not sure if he's here yet, but joining us is Tom Pratt from the NIHR Academy. So we're all here and we'll be all online for the question and answer session, so to take questions at the end of this presentation. I'm just going to start by giving you a brief overview of the awards that are available through NIHR for career development, a little bit about the process, and then we're going to hand over, or I'm going to hand over to Laura, who will tell you a little bit more about how to develop your applications, and then we'll hear from a current award holder, Lorne Power, and then we'll just wrap up with some links that might be useful to you, and then go to the Q&A. So without further ado, the next challenge is to kind of make my slides move. I think I can. So I'll very quickly go through the Career Development Awards, and this is all obviously on the NIHR website, and there are all these little blocks linked to the relevant place on the website, so we will circulate the slides, of course, after this session. So you're probably aware, but NIHR offer awards at all stages of career development. So the main ones that we'll talk about in this series of webinars are the Pre-Doctoral Award, the Doctoral Award, which is the focus of today's session, and the Post-Doctoral Award. So very briefly, the pre-doc is to support you to undertake work at master's level and to develop an application for a PhD. This competition opens once a year, usually in January, with a deadline of March, and they are 12-month posts, or up to 12 months full-time equivalent. You can split it over a lower full-time equivalent and extend it for a longer time in duration. And they allow up to 20% of your time for your practice if you're a practitioner. The Doctoral Award, which we'll say much more about today, but this is support to allow you to complete a PhD. So that includes costs for your salary, for support staff or shared staff who will help you to do your PhD work, training and development costs, including travel and subsistence, conference attendance, and so on. There's also, you can apply for funding for equipment and things that you might need, consumables to do the research. And importantly, there's an expectation, and we're running a separate session on this, but that you'll also include some costs for doing really good public involvement work and making sure your research is inclusive, and so you'll be asked about that. And the final thing I think that you would get costs for or funding for is to think about knowledge mobilisation and dissemination of your findings. So that's all funding that you can apply for as part of your doctoral award. The current round of doctoral awards is open with the closing date of the 15th of January. So it's a little bit tight if you're thinking of going for it this year and you're just starting to think about it. We would always encourage you to come early. These things take a lot of time to develop, but there's a couple of months still for that while that window is open. And then the final award is the Postdoctoral Award, which, as you might expect, is for career development post-PhD. What I didn't say about the Doctoral Award, but you can read on the screen, is they're 3 years full-time equivalent and usually at 50 to 100% of the time. So people might do it over 6 years at 50%. And again, you can have time protected for practice. And with the Postdoctoral Award, similarly, there's 2 opportunities per year, April to June and October to December. These are usually 2 to 5 years full-time equivalent, so longer awards, again at 50 to 100%, and this time you can have 40% of your time for practice. That award window is open at the moment, but closing quite soon before Christmas. So that's just summarising all that again, but what I did want to draw your attention to is you may be aware that the Career Development Awards were changed over the last year or so by NIHR, and there used to be a separate sort of track for local authority applicants. Now everyone applies through the same sort of system, but just wanted to flag that the applications are then triaged out to different panels. So if you're applying from a local authority, yours would not go to the health and care professionals or the other doctoral researchers. Your application would go to the panel that reviews local authority social care and public health applications. So they have expertise in that area. Just quickly, very quickly, flag a couple of additional awards that I just make you aware of, that at the Specialist Centre for Public Health, we also offer what we call our Public Health Grassroots Awards. They've just opened and we're running a webinar on those on Thursday, and there's a link on the slide there if you want to sign up for that. Closing date for those is 27th of January. So they're very small awards of £5,000, just to for people new to research who sort of want to dip their toe in, see if it's for them. You may also well have heard about the Local Authority Short Placement Award for Research Collaboration, which we call LA Spark for obvious reasons. And that offers opportunity for local authority staff and staff based in universities to have a sort of exchange for a short period of time to get a taste of what it's like in the other world and get some experience through that. And for any of the awards, or not for the LA Sparks and the grassroots, but for any of the main career development awards, the NIHR also have this pre-application support fund, which you can apply for to free up some time for you over a 12-month period or up to 12 months full-time equivalent to develop your career development application award application even. So we won't go into those today, but just to flag those there, and we're happy to talk to you about those. I'll very quickly run through the process, but this is again all available on the website, so I won't labour this today, but essentially you need to register on the NIHR's awards management system, navigate to the right place, following those headings there, and then you develop your application. Your application consists of summaries, so there are three: a sort of scientific summary, a lay summary or a plain English summary, and also a summary of how you're involving people and communities in your research, so the public involvement part. You get 10 pages to describe what your research will be that you'll be doing for your PhD, and then you're asked to submit a narrative CV, which is 3 pages. We're also running a session on narrative CVs coming up, I think, on the 24th of this month. And then there's another 3 pages that you have available to talk about your career development plan, so what your development and training plan is. And then also the other things that I've listed on the slide here that you'll be asked to submit. If you're shortlisted, if in this round, you would be made aware, so that's with the January deadline, you'd be made aware by May of next year and invited to interview, which would be in June of next year. And if you get to the interview stage, you're asked to give a 5-minute presentation on your work and your plans for development, and then you receive questions from the panel. And if you're successful at that, or if you're not successful at that, you get the decision either way, July or August of next year. So that's the kind of time scale of things. And the important message I think that we want to get across today is that we can support you with all of this at the Specialist Centre for Social Care and the Specialist Centre for Public Health. So please do get in touch, and the links to contact us are there on the slide. I think, I was about to hand over to you, Laura, but one last slide from me. So just to why might you want to apply for a career development award if you're working in a local authority? And this Dahlgren and Whitehead model is probably familiar to most of you on the call, I would imagine, but we know that decisions that local authorities make really impact on the wider determinants of health in a way that's not the case for the NHS. So local government should be involved in research and in generating the evidence to inform those decisions. And I asked Helen Walters, who's a public health consultant to the NIHR Public Health Research Programme, for sort of her thoughts on why we should be doing research in local authorities, and this was what she said. So no one questions the NHS's involvement in clinical research. Likewise, no one should question local government's involvement in the wider determinants of health. And I am going to pass on to Laura at this point, who's going to talk you through developing your research ideas and developing your applications. Thanks, Laura. You'll have to do the next slide bit if that's okay.
Thanks, Louise. Yeah, I'm really going to talk through not necessarily so much of exactly what to include, but the things that you need to think about as you're pulling your application together. And the first one I'm going to start with might sound really basic, but really consider which level you're proposing to start at. We're talking today about the doctoral fellowships, but we know that in previous years, most of the doctoral awardees were had previously had a pre-doc award. So consider yourself, consider your context, your learning, your knowledge, your skills development. Is there a space in there for you to do a pre-doc ahead of the doctoral that will strengthen your doctoral, or are you ready to go straight in at the doctoral level? Read the guidelines, read them again, and then ask about the bits that you don't understand. Please make sure that you're really, really clear on what you're being asked to demonstrate in your application. You want to make sure that your application stands out amidst the crowd of applications that are coming in. You don't want to make easy mistakes that could have been avoided. So really do talk to people, make sure that you are actually doing what you're being asked to do, and that you're bringing together all the pieces of your application jigsaw puzzle. It's not just about the project. It's not just about the research study. This is about an investment in you as a practitioner researcher, either in public health or in social care. So actually bring it all together. Why are you the right person to do this research project at this place, in this time, with this program of training involving these people? Make sure that you're thinking about that big picture. And thinking about those people, make sure that you've built the right team to support you. You want to be clear that there's a clear rationale for your supervision team. And I'll talk a bit more about supervision teams in a second. But actually, is there a clear rationale? Is it obvious why these people are the people supporting you and why they're bringing the right mix of knowledge and expertise to help you out and work you through this doctoral program? This one's the tricky one. This one is not an easy one to do, but in all seriousness, get as much advice and criticism as you can while putting your application together. Reach out to experts, reach out to non-experts, reach out to lay people, get the feedback, reach out to people with lived experience and get that feedback. And be really thick-skinned about this. Be prepared for them to say this bit's rubbish, that bit's rubbish, the other bit's rubbish. Because you don't need people in this development stage who are telling you that you're great. You need people who will help you be better. You need people who will pick up on any of the weak spots in your application and help you improve them. So don't be afraid to ask for that criticism and don't be afraid to use it when you get it back. You move me on, Louise. Thank you. You also want to think about the importance of your research. I said already that make sure you know this is not just about the project, this is about you as the person to do it. You need to be clear about where this research interest is coming from. Why is it important? Why should we care? Why should we put NIHR resources into researching this thing as part of your doctorate? So you're thinking beyond, I'm just interested in this, but also, why does this matter to us? Why does it matter to practice? Why does it matter to public health settings? What difference is it going to make? And go beyond talking about just being interested in your topic and just being interested in research. Actually think about how have you engaged with research up to this point? How have you used it? How have you used it in your practice? How have you linked fellow practitioners into it? What connections have you built up to support the work that you're doing? Why should the NIHR invest in you? You don't have to write an application that's an academic application. You are writing practitioner applications, but they still need to be good practitioner applications that really impress people because you want to stand out from the crowd of applicants. These awards are popular. You want your award to be one that someone notices. And about that, therefore, make sure that you're thinking forward. Actually, how is your research contributing to developments, improvements in practice? Where will you go with this doctoral work? How are you going to take it forward if you're successful, if you get this award, if you do this doctoral work? Where does it go from there? How will you take it forward after that? And remember that 80-20 rule. Louise mentioned it already, but your fellowships are 100% funded, but you will spend 20% of your fellowship time in practice, training and professional development. So think about how you're going to use that 20% of your time and how the work you're going to do there will fit within your doctoral application. Move me on again, Louise. Thank you. So thinking then about your training and development plan and how you're going to pull that together. Make sure that actually, as you're thinking about your training and development plan, that it's yours. It reflects on you, your current skills, your knowledge, your experiences, your qualifications, where the gaps are and how you're planning to fill those. And don't reinvent the wheel here. Yeah, use the Vita Research Development Framework that's been put together by researchers, by practitioners, to look at actually what is needed in a researcher. Use that to make sure that you're covering all the angles and you've included everything you need to include. Think about what options you need for specialist and advanced training and how well it matches. Is there a match between the training program you're putting together and the research study you want to do? Will it make sense to the person on the panel reading your application why you want to do this training and how it will help you develop? Because that's what's going to convince them to fund you. Think about how you will do networks, collaborations, placements. How can you use those things for training and development? Do you need to build a collaboration to support your study? Do you need to build up your network to develop your academic profile? And drawing directly from that, think about conferences, not just in the sense of I will go and present at this conference to share that what I'm finding out, but also what conferences will be valuable for you to go to in terms of who you're sharing the knowledge with and who you can build the networks with while you're there. So really think, dig deep into those ideas, make sure your rationales are good. Anything else? Anything that we've missed? We've suggested there is, along with your supervisors, is there a specialist who might be willing to be a mentor and would be useful to be a mentor? Consider inviting them into your team. Speaking of which, if we move on one more slide, mentors and supervisors. The important things to think about here is, have you got the right people? Are they credible? Are they committed? Do they have capacity? When you email them, do they email you back within a reasonable time frame? Yeah. Are they able to take on this work? Are they bringing in the right knowledge, the right experience, the right skills to support you? And if not, is that a gap that you need to fill? Or do you need to look elsewhere? In all seriousness, also think about personalities. Try not to have as a supervisor someone that you immediately clash with and don't get on with, because you're going to work with them for 3 years, possibly longer if you're working part-time. Actually, this is someone you need to build a relationship with. This is someone who will be working with you, critiquing your work, advising you and guiding you. So start early with this. Reach out to people. Remember I said earlier on, be thick-skinned about criticism? Also be thick-skinned about rejection. Throw out some emails to the right kind of people. Check out academic profiles. Talk to existing contacts that you have, research networks that you have. Who's active in your field on social media? Might they be a good supervisor or someone good to involve? Can you reach out to them? The worst that will happen is they'll say no. You've lost nothing by asking. But when you do ask, make sure that you're very clear on what you're asking for. What role do you want this person to fulfill? What kind of commitment are you expecting from them? Because that will help them to give reasonable answers about their capacity. Stay in regular contact with people as you're developing your application. As we've said there, I mentioned it already, good mentors and supervisors will be responsive. You want people who are invested in what you're doing, that it's a thing that they want to prioritize, because those are the people you're going to get the best support from. And think through, as you pull this team together, how are you going to manage them? How are you going to use them effectively as your supportive team as you work through your doctorate? And have you made that clear on your application? I think I'm handing to Lorne at this point, if Lorne is back and available.
Hello, that's me. Hopefully you can hear me. I don't have a
Excellent.
fancy slide, unfortunately. So yeah, I'm a social worker and a current NIHR Doctoral Local Authority Research Fellow, based between Brighton Hove City Council and the University of Sussex. So I did the pre-doctoral fellowship. I was on the first cohort when local authorities were allowed in to the NIHR. So I did that part-time over 2 years, doing the social research methods masters at Sussex, which was really helpful in terms of helping me kind of refine my ideas and design the research that I want to do and develop those skills. Part of the way through that, I got a promotion at work, which is very nice. So to the first autism commissioner locally. So I was able to kind of use the research skills that I was developing in order to develop the local autism strategy and co-develop it with the local community, which is really nice about how my local authority was able to kind of recognise those skills that I was developing and then able to kind of use them in practice. At the moment, so I'm now halfway through data collection, halfway through my PhD, which is why I might seem a little bit zonked. My brain is maybe not quite in gear. Really enjoying it a lot. It's not been easy, but I definitely really feel I can see, I'm at the point now where I'm starting to kind of see my own development and also see the potential impact that my work can have on the communities that I'm working with, which is a really nice feeling to have. So for example, I'm doing my PhD full time. My research is around exploring what good social care support means to trans people with a learning disability. So I'm doing kind of longitudinal in-depth qualitative research with a small group of participants, and then also I've got a lived experience steering group that I'm working really closely with throughout the project. And I think it's already been kind of said that engagement is really important as part of NIHR applications, but also engagement as local authority staff is something that we do all the time and we think about. Yeah, I think that shouldn't be a problem for any of you. So Mark asked me to think about what I would have wanted to hear if I was in people's situations. So I think it's really important to acknowledge that local authorities are in a very different place compared to NHS organisations. We don't have the same culture around research yet. And also we're in an extremely challenging financial situation. And you know, I think we can't pretend that we're not. So that does inform the conversations that you have with your manager if you're interested in doing an NIHR fellowship. And getting that kind of initial sign-off is something that people can find quite challenging depending on the different local authority where you're based. So my recommendation would be for that, would be around if you kind of are having a bit of a challenging time from your immediate manager, and look at who are the kind of allies in your organisation who might be interested in research. So for example, is there anybody in the public health team who's developing a research strategy for social work? Is your principal social worker kind of on board, keen? Can you have a conversation with them? Really think about the sort of what I guess what they call quality agenda. So increasingly CQC and Ofsted are kind of asking questions about how research is used in practice and where, certainly in terms of the more recent CQC inspections, they've been really positive where there has been practitioner research involved and embedded within practice. So that is obviously, that is a very thing that your manager will be interested in, particularly if you're a social worker. I think like I said, engagement, what is sometimes called patient and public involvement is absolutely key, and it takes a long time to do it properly because it's about building relationships. I got some funding available for that, which the specialist social care people can help talk to you about. So to kind of recognise the time of the people who the people with a learning disability who I was working with as part of developing my application, and actually one of them is now on my steering group as well. So those can be long-term relationships as well that can really continue to inform the research that you're doing. I think also, like I said, it's a very new concept. This is culture change, takes a very long time. So yes, you know, it is a challenging path. There is a lot of, the NIHR is still getting its head around local authorities and how we're different, and also they're increasingly listening and understanding to us about our experience and how they need to sort of think about differently about local authority researchers, but it does mean there is a few what might be teething problems around that. And then also I think finally, I think a lot of the time when I'm speaking to, so I kind of mentor other social workers who are interested in research, and imposter syndrome is a really big issue. I think I would encourage you to sort of think about that in two ways. One thing is to kind of flip it round. So kind of think about, why do you think you're not the right person for this? Because actually the whole point of the NIHR fellowship schemes is recognising the practice knowledge and the lived experience that we all have as local authority staff, and the how valuable those relationships that we have, the knowledge that we have about how things work, in the communities that we're working with. So I would really question you to think, why do you think that you aren't right? Because you're probably exactly the right person for it. And then secondly, I'd also really encourage you to think about what skills you can bring that you already have, particularly, you know, I can only really speak from my own experience, but kind of as a social worker, you're doing interviews all the time. We know how to kind of support people in trauma-informed ways. We know how to, you know, facilitate really challenging conversations. And so think about those skills that you could bring that you already have. Is my advice. So happy to take any questions at all in the chat or afterwards. But yeah, hopefully that's helpful.
Thanks, Lorna. That was really helpful and really insightful, and really appreciated your reflections on the kind of how NIHR are working with local authorities, and really are encouraging local authority staff to move into this space and become these research practitioners. So thank you very much for that. And as Lorna said, they'll be around at the end. We're hoping to, well, we will have, I'm going to talk quickly for the next 2 minutes, then we'll have about 15 minutes for questions. So we've just got a couple of slides highlighting, I can't get the slides to move now, highlighting some other people who've sort of gone down this path that we're aware of. So 2 examples here on the slide of people working in social care who've had doctoral awards, and we'll circulate the slides so you'll be able to see more about these when we do that. And also Scott, who's on the call now and is happy to stay for the questions and will be willing to answer questions at the end, has reflected on his journey through, he's had the full gamut of pre-doctorals, LA Spark, and currently doing his doctoral awards, and I know he's on the call and very happy to chat as well. So I'm just going to wrap up with a few pointers to where you can find more information on the NIHR website. So there's a huge amount of information on there, and I think Laura said about the importance of reading that and rereading it. But it's quite, I've just tried to highlight where some of the most important or useful things are that you might want to find. So you can't tell on this slide, but all these boxes do have the link to the relevant bit on the NIHR website. So the overview for this award, the assessment criteria, application guidance, the specific ask from the NIHR about working with people and communities, which is the public involvement part, research inclusion, and then really usefully chair's report from previous rounds of the of application, where they reflect on the applications and what was good and what was bad, so they can be really useful to read when you're thinking of your own award. And that's just the link to the awards management system, so how you get in there in the first place. But as I said before, I think our key message is come to us at the Specialist Centre. So we're separate for this, but we work closely together. So I'm the Specialist Centre for Public Health. Laura and Mark, who's also on the call, a Specialist Centre for Social Care. And we're here to help you to get these applications pulled together and to signpost you to other people that can also support. So our door is always open. And I think that's all I'm going to say, other than to leave you with these contact details. So for both the specialist centres and the Academy at the NIHR who manage the personal awards. And we do have, I think, Tom on the call from the Academy as well, who's here to take questions. So that's it. I think we've just about got there on time with about 15 minutes left for questions if there are some. So I'll stop sharing so that we can see one another better. And then I'm not sure what's in the chat because I haven't been able to see that as I've been sharing. But either put questions in the chat, or if you want to raise a virtual or a real hand if you've got your camera on, and we're happy to go to those questions now. I'll just quickly go through and see what's in, if there are things in the chat that we might want to pick up now. So someone willing to take emails about individual circumstances. So I'm going to look to Tom, if you're on from the Academy. I think the Academy are probably better placed than us at the specialist centres to take those very specific questions about eligibility and remit and so on. Can't see whether Tom's.
Yeah, sorry, I am on the call.
You are.
Yeah, I'd always encourage people to get in touch on the personal awards email address that was on the slides there. So if you do have anything specific, then yeah, get in touch and we'll be happy to advise.
That's great. It's a question about the research being around the wider determinants of health. So yes, we're very much encouraging applications around that. I would that's very much what we're aiming for out here, in that we are very much looking for that research. It's not clinical research, but that it is within it has to be within the NIHR remit, obviously, and that might be something you just want to check. But we're very much mindful that these things that are going on in local authorities impact on the wider determinants and therefore on health. Sorry, I can see some of these have already been answered.
Sorry, Louise, is it okay if I
Yeah.
just, I think it's been answered already, but I know there was some comments about the process of funding being awarded. So just to clarify, I think this was
That would be great.
in the comments as well. So the interviews are the last stage of the committee assessment. So at these interviews, which, as again mentioned before, the committee will be around a table in person, and the interviewees are joining on a Zoom or Teams call. So the committee over those 1 or 2 days will then decide who's fundable from the list of people that they've seen. And then we would go away and then look at in terms of the recommendations, and they would rank the fundable ones, and we would basically just match in terms of what we've got in terms of a budget against what's been recommended. So it's not that someone's awarded a fellowship and then it's taken away from them. It's just a case of the committee say who's fundable. We take that list away and just see, what our budget can stretch to that. So it might be that the feedback is the committee deemed you fundable, but you're not funded in this round, but you would get feedback. And as someone has mentioned, that a lot of times when people do get that feedback, they can make improvements and come back the next time with an even stronger application.
Thanks for clarifying that, Tom. So yeah, so as Tom said, so there'll be a judge to be fundable or not, but a funding envelope is only a certain amount. So it might be there's a cut off at someone with fundable people might be invited to come back to the next round. There's another one thing that we're going to come to you, Tom, for about being based in England. So you need the contracting organisation should be in England, but I think the question is if they apply, if they're not living in England at the time of application, but I guess the organisation they plan to work with is in England, so they will move. So I guess that would maybe be a question to pick up on an individual basis, but
Yeah, I mean, in general, the eligibility would be based on if you've found a contracting organisation that has said that they would employ you for the duration of the award. It's not so important as to where you are at the point of application, but we would want some reassurance from the contracting organisation that they would employ yourself and you would be based in England to undertake the award. So yeah, again, it's probably one of those to get in touch if you've got specific circumstances, and we can talk about those.
Thank you. More about sharing the application management site link. We'll share the slides, and it's in there, as well as on the NIHR website, of course. One about career stage. So yeah, I think we've tried to illustrate that there are career development awards for whatever stage you're at in your career. And we're very happy to have a conversation with you, either Public Health Specialist Centre or Social Care Specialist Centre, to help think through what might be the best place for you to start. And Laura, I know you talked about how almost all the doctoral awards made had previously held pre-doctoral awards. So there is a sort of a pathway through, but obviously if you're already working at a level where you think you're ready to go straight in for PhD, you need to make a case for that in your application, and we can help you to think that through, and what successful candidates typically look like and what will make you competitive. Don't know, Laura, if you want to come in on that.
Yeah, I was just going to say, the thing I'll reiterate on that is, if you're not sure, come and talk to us. You don't need to come to us when you've got a definite idea of exactly what you're doing and how you're going to approach this. If you're sat there thinking, where should I pitch myself? Am I pre-doc? Am I doctoral? Am I somewhere else? Reach out, because we're happy to have those early stage conversations with you. Is a thing that we can support you through and then help you to work through exactly what award you're going to apply for. And it's easier than doing it on your own.
And I would say, you know, that's kind of the message that we want to give is, well, come to us whatever stage you're at, but really we welcome you to, if you come really early, and it doesn't matter if you don't feel, you know, embarrassed that if not, your ideas aren't well enough formulated. We're really happy to see you at a very early stage and help you to make those sort of decisions and think things through. Emily, I can see you've got your virtual hand up.
I was going to type, but what you're saying kind of linked to my question. I'm one of the public health registrars, so I don't know whether how that fits in, because we're sort of a bit in between like the NHS kind of clinical fellow side of things and these sorts of awards that are more authority public health orientated. So would we still fit into this type of award, or would that kind of be something different, or do we maybe not fit into these things at all?
So this is one I'm going to direct to you again, Tom. I'm glad you're here, because I think, as I said, you apply through the same pathway, and then once the NIHR receive them, that's when it's decided which panel will assess your application. I think I'm right in saying, Tom. I don't know whether you can. Oh, you're on mute, Tom. Sorry.
Apologies. Yeah, so you would certainly be eligible to apply. In terms of the triage, I mean, it is a bit for public health registrar. So as in a medical public health or non-medical public health?
Medical, yeah.
Okay.
It's weird because paid by an NHS trust, obviously we're the local authority, and if we talk about placements and that kind of ongoing placement, could easily be the authority, could be the trust, could be some anywhere.
Yeah, I mean, so your application is probably one we would look at and just decide if it's going to the general committee, which is for medics, dentists and non-healthcare practitioners, or if you would fit in the public health theme of going to this committee. But I mean, regardless of which committee you go to, you'd still be looked at by a range of different committee members with different research expertise. So you'd certainly be eligible to apply, and we'd have to have a look at the details in terms of where we triage you in terms of committee.
Thank you, that's helpful.
Thank you. Okay, I'm losing where I'm up to in these. So I think we've covered about when applications are recommended for funding and whether the pot's big enough. It is a very competitive process. Oh, do you know off the top of your head what the rate of successes was from last year?
Got to put a link up for that, Louise.
Oh, thank you. I see lots of these have been answered as I'm scrolling down. Anybody that sees anything that hasn't been answered, please shout out.
I think I've seen a couple of comments, Louise, if I can,
Yeah,
just
sure.
around references and letters of support. So just to clarify in terms of the uploads, the references is just for what you've cited in your research plan. So just in terms of a list of references that you've referred to in the application form. The letters of support are letters that we would expect from the head of department or equivalent in the contracting and potentially the partner organisation, just setting out what the support's going to look like and how they're going to make sure that you're able to reach the aims of your fellowship. What we're not looking for are the types of letters of support from general supervisors. We have got specific sections in the application where we've asked for the support they're going to provide to be outlined, but we're not looking for, you know, dozens of letters from various people other than the head of department from contracting and, if applicable, partner organisation. The references is just the kind of academic references that or other references that you've cited in the research plan. So that is a little bit different to how it was before, but yeah, please don't try and get lots of letters from various stakeholders to include in the application, because they won't be considered by the committee.
Thanks for that clarification, Tom. And the other question was about, does your detailed research plan, your 10 pages, do you have to squeeze your references into there? And I think the answer is no, that's a separate upload. And by references, it's citations rather than references like you would get as character references or academic references. Thank you. I thought I saw a hand go up, but no, I've lost it. If anybody's waiting to ask a question, do shout out. Okay. Oh, David Andrew.
Yeah, thanks very much, Louise. There's a lot of really helpful information in the chat, and one of those hopefully is my wee question as well, but I thought I'd take the opportunity. Having looked at the guidance and the various sections, the one that's given me a bit of a head scratcher is one of the last bits around commercialization and intellectual property rights. Now, from a local government perspective, that's a bit of a head scratcher for me. It's a bit quite niche and techie in some respects. And any thoughts from a local government perspective that might help assuage my concerns on this?
So is your question around what you would be expected to include in a section around IP and commercialisation?
Yeah, basically, it's that sort of thing.
We're looking for Tom again here, but I suspect in many cases there won't be any commercialisation involved in these type of awards. And the question of IP, that's often down to like your research data, which tends to generally the organisation, the HEI university that you're with would generally want to keep any IP around that. But that's something that's, but I think in the sort of work we tend to do in this field, there's not really usually a commercial angle. I don't know if anyone else wants to come in on that one.
I was actually going to come in on. Oh, sorry, go on, Tom.
Sorry, after you, Laura. After you.
I was actually going to come in and say I have repeatedly run into this problem anyway around the type of work that we do in social care, because we're not commercialising it. We don't want to sell it because we don't want to put it behind a paywall. We want whatever we produce, we want to be out there and we want people to be using it. But that's fine. That doesn't mean that there's something wrong with your project or something wrong with what you're thinking to do. It's more about thinking about the fellowships are not just aimed at public health or social care or local authority practitioners. There's a much broader scope of applicants, and for some of them, there may well be that commercial element. I don't know if you wanted to say something different to that, Tom.
No, I mean, it's essentially the NIHR trying to protect its investment. So this is something that is across all awards. So it's looking at any intellectual property that might be used by yourself that isn't owned by yourself or a contracting organisation. So it's NIHR trying to make sure that they're not funding something that then is commercialised, that then gets charged back to the NHS, social care, public health. But it depends on the type of study. It's not something that really gets raised at doctoral interviews unless there's something particularly very techy that gives them a bit of concern that, you know, there's an American pharmaceutical company that's involved, but it's very rare. So I wouldn't spend too much time worrying about it.
Yeah, that's basically the example of where bringing one application process all together, it loses that subtlety and granularity for our particular cohort. I fully agree with what Laura was saying as well. The last thing I would be wanting to, I suppose, espouse through this process is creating something through the public good and then actually seeing it charged back as a result of the process. I'm going to just put none of the above sort of thing.
Yeah, it's only not an aim of we want everything to be commercialized. It's just they want any information that might alert them to something that could be some kind of proposal or development that might be going into the commercial sector, that they want to get everything lined up to make sure we can protect our investment. But yeah, it's generally speaking, for this level, it's not something to be worried about.
Yeah, absolutely. And I guess the only thing we have generally in this area is maybe questionnaires where there's some intellectual property that you might want to protect, but not for commercial reasons, typically, as Laura said. And we're sort of just up to time, or just over, in fact. So I think I will draw to a close, but I hope that's been useful. I think we've dealt with most of the questions.
Louise, sorry, just because it's come up multiple times in the comments about challenges for people in terms of getting their organisations on board. And I just wanted to highlight that we have a session next Tuesday where we're going to specifically talk about the logistics of applying for any award, and that will, I'm not saying we've got any magic solutions, but that will talk about guidance and hints on how to potentially get your organisation on board and work in partnership with them around this. So if people are able to come to that one or sign up so they get the recording link, we might be able to give more insight there. We've run out of time here.
Yeah, and we are aware that that is an area of challenge at the moment, and we are sort of, you know, trying to do what we can to address that. But yes, thanks, Laura, and we will cover that next week. And we're going to also in that session look at think about public involvement and research inclusion as well. So thank you very much. I know everyone's probably got to get to other meetings and things now, but thanks Tom especially for joining from the Academy. It's hugely helpful, and thanks to Laura, Mark and Lorne, and to Scott, who's been dealing with a lot of the questions, and look forward to hearing from you all. And our overriding messages, please do just get in touch. We're really happy to have an early chat, and we'll do our best to support and direct you wherever can help you best. Thanks very much, everyone. Bye for now.